Natural sounds harmless, not always, especially after 60. A hospital review found risky interactions in about 6 of 10 herbal cases. I am Drew Mercer. Welcome to Agestrong. After my dad's fall, I got obsessed with safe strength and safer health choices. I saw how one small change can protect independence. Herbs are powerful. That is why we treat them like medicine. Slower liver and kidney function mean herbs last longer in the body. Many of us take several prescriptions together. That is called Polypharmacy, which means 5 or more medications. When you add an herb on top, the stack can wobble fast. Some herbs thin blood, some block heart and mood meds, some strain the liver. Most supplements are sold as foods, not drugs. That means they do not face the same pre-market tests. A bottle on a shelf does not equal safe for seniors. Today I will make it simple. 4 herbs to avoid after 60. Then 4 herbs that may be worth daily use with your doctor's guidance. This video is education, not medical advice. Your safety comes first. Let's start with why age changes herb safety, then count down the avoid list. Your body changes with time. Medications add up too. That changes how herbs act. Slower blood flow through the liver means slower breakdown, kidneys clear waste more slowly with age. So a dose that is mild at 40 can be too strong at 70. Many older adults take several prescriptions each day. Blood thinners, heart pills, antidepressants, diabetes meds, and sleep aids are common. Herbs can nudge those drugs up or down. Some herbs thin blood more. Others wake up liver enzymes and lower drug levels. That can mean clot risk, high blood pressure, or transplant rejection. Most supplements do not get the same safety testing as prescriptions. Labels can leave out interaction warnings. Doctors may not hear about your herb use unless you tell them. I teamed up with a geriatric physical therapist and a cardiology nurse for this channel. We see safer outcomes when people share everything they take. What medicines sit on your counter that a pharmacist should know if you add an herb? Keep that list close and updated. We are ready for the countdown. Number 4 on the avoid list is common in men and often hides its risk. Number 4 on the avoid list. Saw palmetto looks harmless. It can increase bleeding risk. Many older men try it for prostate symptoms like frequent trips at night. Here's the catch. Saw palmetto can add to blood thinning, and blood thinners include warfarin, apixaban, rivaroxaban, and dabigatran. Antiplatelet drugs include aspirin and clopidogrel. Cardiology reviews have warned about extra bleeding when these combine. Nosebleeds, bruises, and internal bleeding can sneak up. For seniors, even a small bleed can lead to a fall or a hospital stay. A client named Mark once told me he started it on a whim. He was also taking aspirin for his heart. His pharmacist saw the bottle during a med check and flagged the risk right away. Mark tossed it and felt safer. If you are on any blood thinner, avoid saw palmetto unless your clinician says otherwise. Stop it before dental work and surgery too. Store shelves do not show this warning clearly. Prostate symptoms deserve care that fits your full health picture. The takeaway is simple. Do not stack blood thinners with this herb. Up next, a memory booster with similar bleeding risks. Number 3 on the avoid list. Ginkgo promises sharper memory. The risk is thinner blood. Ginkgo can make your blood less sticky. With warfarin, aspirin, or other blood thinners, that effect adds up. Case reports have linked Ginkgo to serious bleeds, including brain bleeds and eye bleeds. That is not a trait I like for anyone, especially at 60 plus. Some Ginkgo seed products also contain a compound called Ginkgo toxin. That compound can lower the seizure threshold. Older brains are more sensitive to that stress. Even leaf extracts, the common form, still carry the bleeding risk. Bruising easily, nosebleeds, and black stools are red flags. If you have atrial fibrillation or take medicine for heart rhythm or blood pressure, Ginkgo adds uncertainty. Cardiology and pharmacology reviews have put clear caution labels on this mix. Pharmacists see this often during medication reviews. The safer choice is to skip Ginkgo if you use any blood thinner or have a seizure history. If you already take it, have a conversation with your pharmacist this week. Memory deserves steady support, not risky surprises. From memory to mood, the next herb can quietly turn off your prescription medications. Number 2 on the avoid list. St. John's wort sounds gentle. It can switch off many prescriptions. This herb revs up liver enzymes. These enzymes are drug processing proteins. When they speed up, blood levels of your medicines drop. That includes warfarin, digoxin, many statins, many heart rhythm drugs, and some blood pressure pills. It also turns on a pump in the gut called P-glycoprotein. More drug gets pushed out before it works. There are real-world stories of transplant drugs losing effect after this herb. Mood medicines are another problem. St. John's wort can interact with antidepressants and raise serotonin too high. That can cause restlessness, sweating, and confusion. You might feel fine for weeks, until one day a crisis appears. Labels do warn sometimes, but not always. The safest play after 60 is to avoid this herb unless a clinician is guiding you. If you want help with mood, ask about other options. You deserve a plan that does not sabotage your prescriptions. We have one more avoid herb. It looks relaxing, yet it has a tough record with the liver. Number 1 on the avoid list. Kava relaxes the nerves. The liver can pay the price. Reports around the world have tied kava to severe hepatitis and liver failure. Some countries restricted it in the early 2000s after dozens of cases. Older livers process toxins more slowly. That means kava can build up and cause more harm with time. It also makes you sleepy. Combined with alcohol, sleeping pills, pain pills, or anxiety meds, it can slow you too much. Falls become more likely. After my dad's fall, I learned to respect anything that slows reaction time. Yellowing skin, dark urine, nausea, and belly pain are warning signs that need urgent care. If you use kava now, please talk with your doctor about tapering off. If you want calm, many safer tools exist, as I said, from breathing to physical activity to vetted therapies. I do not recommend self-prescribing kava at any age. At 60 plus, the margin for error shrinks. We have covered the 4 most risky herbs. Let's look at the hopeful side. Some plants may support seniors when used with care. You might feel discouraged now, I get that. Here is the good news. Some herbs show early benefits in studies with older adults. Think immune support, heart and circulation support, stress relief, and brain support. We will cover 4 options that may be worth daily use or a careful trial. Safety still leads the way. Start low. Tell your doctor and your pharmacist. Keep a full list of everything you take. Bring that list to every visit. In our clinics, I work with a geriatric physical therapist and a cardiology nurse. We see the best results when people share openly and track how they feel. Echinacea may help shorten colds a bit. Hawthorn has evidence for mild heart failure symptoms. Ashwagandha can support stress and sleep. Lion's mane shows promise for memory in small trials. None of these are magic. They are tools to use with guidance. If this helps you, consider subscribing for more safe, evidence-based guides. It keeps this work going and gets you our new checklist. Now let's count down the 4 herbs to consider. We start at number 4 and move toward the option with the strongest brain promise. Number 4 on the use list. Echinacea has a long history. The idea is immune support. Some clinical trials suggest it may shorten colds by about a day. Other trials show little benefit. Overall, it looks modest at best and safe for many. It seems to nudge white blood cells, the immune helpers. If you choose to try it, timing matters. Start at the very first signs of a cold. Ask your clinician first if you take any prescription drugs. Avoid it if you have a transplant or take strong immune-suppressing medicine. Be careful if you have ragweed or daisy allergies. Use a reputable brand with a clear dose on the label. Keep it for short courses during cold seasons. Track how you feel and stop if you notice rash or stomach upset. This can be a small tool in your kit. Your doctor can help you decide on the right product and dose. From immune health to circulation, the next herb supports the heart and blood vessels. Number 3 on the use list, Hawthorn supports circulation. It has old European roots. Studies in people with mild heart failure show improved exercise tolerance and less chest discomfort. The compounds in Hawthorn can open the coronary arteries a bit. That means better flow to the heart muscle. Some people see a small drop in blood pressure. Quality matters with this herb. Look for standardized extracts that list the active compounds. Here is the caution. Hawthorn can amplify the effects of nitrates and some blood pressure medicines that can drop your pressure too far. It can also change how quickly your heart pumps. Talk with your cardiologist or pharmacist before starting it. They may suggest a low dose and careful monitoring. Do not use Hawthorn in place of prescribed heart treatment. Use it only as a possible add-on with medical guidance. When used well, many people report better walking and less fatigue. Now, from heart to head, let's talk stress and memory. Number 2 on the use list. Ashwagandha is an adaptogen. That means it helps your body handle stress. Small human trials show modest gains in memory, sleep, and calm. Some people see lower morning cortisol, the stress hormone. I have seen clients feel a little more focused after a few weeks. Start low and give it time. A common dose is 300 milligrams once per day. Safety first here too. It can cause drowsiness and mild stomach upset. There are reports of thyroid hormones rising in some users. If you have thyroid disease or take thyroid pills, ask your doctor before starting. Use extra caution if you have autoimmune disease, liver disease, or take sedatives. Stop if you feel jaundice, itching, or unusual fatigue. Choose a brand that tests for heavy metals. Track your sleep and attention in a small notebook. That way you can judge if it helps you. One more brain helper is next. It is a mushroom with promising research. Number 1 on the use list, lion's mane is a mushroom. It may nudge nerve growth. Compounds in this mushroom stimulate nerve growth factor in lab and animal studies. A small Japanese trial in older adults found better cognitive scores after several months of daily use. Gains faded after stopping, which suggests a true effect. In the real world, people with mild memory complaints sometimes use it as a daily helper. It is generally well tolerated. If you have a mushroom allergy, avoid it. Choose a brand that clearly lists the fruiting body and the dose. Some people like tea, others prefer capsules. This is not a cure for memory loss. It is a possible tool alongside movement, sleep, social time, and a brain-friendly diet. I like to pair any brain supplement with a simple walking plan. That combo supports blood flow and mood too. If you try lion's mane, tell your doctor and pharmacist. Track word recall, names, and daily focus over a month. One last step now. Let's talk about choosing and using any supplement safely. Labels can mislead. Stores do not test. You need a simple plan. First, make a complete list of all medicines and supplements. Keep it in your wallet and on your phone. Second, choose only one new product at a time. Start at the lowest dose. Third, look for third-party seals like USP or NSF. That means the label was verified by an outside tester. Fourth, avoid multi-herb blends with hidden doses. Pick a single herb with a clear extract number. Fifth, check interactions with your pharmacist. Mention blood thinners, antidepressants, seizure medicines, and transplant drugs right away. Sixth, set a stop date. If you do not notice a clear benefit by then, stop. Seventh, watch for warning signs like easy bruising, yellow skin, dark urine, new confusion, or a rash. Get help right away if they appear. Remember, supplements are not pre-approved for safety like prescription drugs. That is why we lead with caution. Now, let's wrap up and put this knowledge into action. We named 4 herbs to avoid and 4 to consider. Your journey is not over. The key is to use any herb safely with your doctor's help. We combed through cardiology and pharmacology research, including major cardiology reviews and Cochrane analyses, to shape this guidance. Many regulators have warned about Kava and about herb-drug interactions. One hospital review found about 6 in 10 herbal cases had a risky interaction. Always read the label. There is no automatic safety guarantee in supplements. Your next step is simple. Download the printable checklist in the description and bring it to your next visit. Ask your doctor and pharmacist to review your list. If this video helped, please subscribe for more clear senior safe guides. Thank you for spending your time with me today. You are taking smart steps to stay strong and independent. This is Agestrong, and I am glad you are here. Which herb surprise will you talk to your doctor about?